Right now, somewhere in your chest, your heart is sending you a message that could save your life. But the truth is, most of us have learned to ignore the very signals designed to protect us. We dismiss the tightness as stress, the fatigue as getting older, the shortness of breath as being out of shape. What if those whispers your body is sending are actually urgent warnings you can't afford to miss? Heart disease doesn't announce itself with trumpets and fanfare like we see in the movies on television. It creeps in quietly, leaving breadcrumbs of symptoms that seem too small to matter at the time. Until one day, those breadcrumbs lead to a moment that changes everything about your life forever. The question that haunts cardiologists is this: why do we wait until crisis strikes to finally listen? Your heart is an extraordinary muscle, beating roughly 100,000 times every single day of your life. It pumps 2,000 gallons of blood through 60,000 miles of vessels without ever taking a break. This tireless engine powers every breath you take, every thought you think, every moment you're alive and breathing. But like any engine pushed too hard for too long, it can begin to fail in ways that whisper before they scream. Have you ever felt a strange pressure in your chest that made you pause and wonder what it meant? Perhaps you've experienced unexplained exhaustion that steals your energy long before the day is done and over. These aren't just random inconveniences your body throws at you to make life more difficult or frustrating. They're your cardiovascular system waving red flags, desperately trying to get your attention before it's too late. Inside your arteries right now, a story is being written in cholesterol, inflammation, and microscopic damage accumulating. When you eat foods rich in saturated fats, your liver produces more cholesterol than your body actually needs. This excess cholesterol travels through your bloodstream, searching for places to deposit itself along arterial walls everywhere. At first, your immune system treats these deposits like invaders, sending white blood cells to clean them up. But when the deposits keep coming day after day, year after year, your immune system becomes overwhelmed completely. Inflammation spreads like wildfire through the vessel walls, creating a toxic environment where plaques begin to form. These plaques are like tiny dams building up inside your arteries, narrowing the channels where blood must flow. What happens when your heart muscle doesn't get enough oxygen-rich blood to fuel its relentless, never-ending work? The pain arrives first as angina, a crushing sensation that radiates from your chest into your jaw and arm. Your heart is literally crying out, telling you that it's suffocating, that it needs help right now immediately. But here's what many people don't realize. Heart disease often shows different faces in different bodies and genders. Women may experience nausea, back pain, or overwhelming fatigue rather than the classic chest pain men typically feel. This is why so many women arrive at emergency rooms too late, their symptoms dismissed as anxiety or indigestion. The stakes are staggering. Heart disease claims more lives globally than any other condition we know of today. Every 36 seconds, someone in the United States dies from cardiovascular disease, a preventable tragedy in many cases. Yet despite these numbers, millions of people walk around with warning signs they've convinced themselves don't matter much. Scientists have discovered something remarkable when they study the progression of heart disease in populations over time. The damage doesn't happen overnight, but accumulates through thousands of small choices we make every single day. That morning donut, the cigarette at lunch, the stress you carry like a heavy backpack everywhere you go. Each one sends ripples through your cardiovascular system, ripples that eventually become waves of serious dysfunction. Your blood pressure rises as your vessels lose their flexibility, becoming stiff pipes instead of elastic highways. Meanwhile, inside your heart muscle itself, cells are beginning to struggle under the burden of inadequate oxygen supply. When heart cells die, they don't regenerate like skin cells do, leaving permanent scars in the tissue forever. This is why time matters so desperately when someone experiences a heart attack or other cardiac emergency. Every minute without treatment means more heart muscle dying, more function lost that can never be recovered again. But here's the profound truth that should give us all hope. Most heart disease is preventable through lifestyle choices. Your arteries have an extraordinary capacity to heal when you remove the factors that damage them day after day. Studies show that people who adopt heart-healthy habits can actually reverse some of the damage already done inside. The Mediterranean diet, rich in olive oil, fish, and vegetables, reduces heart disease risk by nearly 30%. Regular exercise strengthens your heart muscle, improves circulation, and helps your body manage cholesterol levels more effectively. Even moderate activity, like walking 30 minutes a day, can dramatically reduce your risk of cardiovascular events. What would it mean to you to take control of your heart health before symptoms force you to? Managing stress isn't just about feeling better mentally. Chronic stress floods your body with hormones that damage vessels. Cortisol and adrenaline, released during stress, cause inflammation and raise blood pressure to dangerous levels over time. Sleep is another crucial factor that most people underestimate when thinking about their cardiovascular health and wellness. When you consistently sleep fewer than 7 hours nightly, your risk of heart disease increases by nearly 50%. During deep sleep, your heart rate slows, blood pressure drops, and your cardiovascular system gets precious time to repair. Smoking remains one of the most devastating assaults you can launch against your heart and blood vessels daily. Every cigarette damages the delicate lining of your arteries, making them more vulnerable to plaque formation and rupture. But here's what research shows: within just 1 year of quitting, your heart disease risk drops by 50%. Within 15 years of quitting smoking, your risk becomes nearly equal to someone who never smoked at all. These aren't just statistics on a page, they represent real lives saved, real families kept whole and together. Think of someone you love deeply, someone whose presence in your life feels absolutely essential and irreplaceable right now. What warning signs might they be ignoring because they seem too busy or too scared to face the truth? The most dangerous phrase in medicine might be, "I'll deal with it later when things calm down." Later has a way of arriving suddenly, urgently, when options become limited and outcomes far less certain than before. Your body speaks in symptoms, a language we must learn to understand before the volume becomes a deafening scream. Unusual fatigue that doesn't improve with rest could signal your heart is struggling to pump blood efficiently throughout your body. Swelling in your legs and ankles might mean fluid is backing up because your heart can't circulate it properly. Irregular heartbeats, feeling like your heart is racing or skipping beats, deserve immediate medical attention and evaluation. Dizziness or lightheadedness, especially with exertion, could indicate your brain isn't getting enough oxygen-rich blood to function. These symptoms are your body's way of saying something is wrong. Please pay attention. Please get help now. Modern medicine offers remarkable tools to diagnose and treat heart disease when we catch it early enough to intervene. Electrocardiograms can detect irregular rhythms. Stress tests reveal how your heart performs under exertion and increased demand. Advanced imaging shows doctors exactly where blockages exist, how severe they are, and what interventions might help most. Medications can lower blood pressure, reduce cholesterol, prevent clots, and give your heart the support it desperately needs. In severe cases, procedures like angioplasty can open blocked arteries, restoring blood flow before permanent damage occurs. Bypass surgery creates new routes around blockages, giving your heart muscle the oxygen it's been starving for too long. But the most powerful medicine isn't found in a pill bottle or an operating room at all, surprisingly enough. It lives in the choices you make 3 times a day at meals, in how you move your body throughout the day. It exists in the moments you choose to breathe deeply instead of holding tension in your chest and shoulders. Start by knowing your number's blood pressure, cholesterol levels, blood sugar, and body mass index are crucial baseline measurements. If you don't know these numbers, make an appointment with your healthcare provider this week to get them checked. Aim for blood pressure below 120/80, LDL cholesterol under 100, and a healthy weight range. Add more whole foods to your plate: colorful vegetables, whole grains, lean proteins, and healthy fats from nuts and fish. Reduce processed foods, which are often loaded with sodium, sugar, and unhealthy fats that assault your cardiovascular system daily. Find movement you actually enjoy, because exercise you hate won't become a sustainable habit that lasts for years. Dancing, swimming, hiking, cycling, even gardening counts as physical activity that strengthens your heart muscle over time. Build a support system of people who encourage your health goals rather than sabotaging them with unhealthy habits. Practice stress management techniques that actually work for you: meditation, yoga, deep breathing, time in nature, creative expression. Remember that small, consistent changes create compound effects that transform your health over months and years of commitment. You don't have to become perfect overnight. You just have to become slightly better than you were yesterday. Your heart has carried you through every moment of your life, beating faithfully even when you've neglected it. It deserves your attention, your care, your commitment to protecting it from preventable damage and unnecessary suffering. The warning signs you've been ignoring aren't going to disappear on their own without intervention and lifestyle changes. They're invitations to act, to choose life, to honor the extraordinary gift of your beating heart right now. Every person who survives a heart attack wishes they had listened to the whispers before they became a scream. You have the power to write a different story, one where prevention triumphs over crisis and emergency intervention, where knowledge becomes action, where fear transforms into empowerment, where small choices create profound health outcomes over time. Your heart is waiting for you to become its partner in health rather than its adversary through neglect. The next time you feel that tightness, that fatigue, that breathlessness, don't dismiss it as nothing important. Listen with the respect those signals deserve, and consult your healthcare provider about any concerning symptoms you experience. Your life, your future, your presence in the lives of those who love you, all depend on this choice. The warning signs are there, speaking clearly and urgently, and now you know exactly how to hear them.